It's been 2 years since the start of the coronavirus pandemic, and in New Jersey, the state's confirmed 1.8 million COVID cases so far. New Jersey is a very different place now. COVID cases continue to drop, and residents have learned to live with the virus and will continue. But we thought it was a good time to look back at how far we've come. March 4th, 2020 marked the state's first recorded case of COVID-19. Since then, there have been more than 30,000 confirmed deaths in New Jersey. Month after month, there's been uncertainty and fear. And then in December, the Omicron variant hit. But one woman has been a constant in New Jersey's fight against the coronavirus.
With that, please help me welcome the woman to my right, who needs no introduction, the Commissioner of the Department of Health, Judith Persichilli.
Thank you, Governor. Good afternoon.
Since the beginning of the pandemic, New Jersey Department of Health Commissioner Judith Persichilli has led the state's efforts against COVID-19. She has been at Governor Phil Murphy's daily coronavirus briefings. I believe there have been more than 400 of them in the past 2 years. The commissioner has made it her mission to educate, vaccinate, and get New Jersey boosted. Commissioner Persichilli joining us now. You've been on the job since 2019, and you're the first registered nurse to hold this position. During your career, you've also been an executive for hospitals and healthcare systems. Welcome, Commissioner. We thank you for your time. How are you?
I'm doing well. Thank you for having me today.
Monday, a big day. Students can return to school in your state without their masks if they so choose. And so now that districts in New Jersey can make their own decisions, how do you expect the schools will handle it? And what's your guidance to districts to keep staff members and students safe?
The most important thing we have to remember is that masks are just one part of a number of mitigation strategies to keep all of us safe, and particularly our children in our schools, along with physical distancing, good ventilation, washing your hands frequently, staying home if you're ill. All of that together provides a safe environment. The most important thing our school districts can do is to look at the transmission of disease locally in their communities and make the best decisions for their schools. We have seen over time that exposures in schools follow community transmission.
The information hub the state has, I was looking at that too, and it goes by county. People can get so much information there. It's very helpful. Let's go back 2 years as we headed into this virus. And, you know, we didn't know what was ahead. We lay people here. So listen first, and then we'll talk about it. Here's a clip from March 5th of 2020.
Most New Jersey residents are still at very low risk of contracting COVID-19.
So that was then. When did you realize how bad this was going to be?
I would say we had our first case March 4th. We still felt the transmission was quite low. About 2 weeks after that, we did have an outbreak amongst family members at a gathering. And I think there were about 25 people at the gathering, and 15 of them came down with COVID. And unfortunately, there were a number of deaths. I think it was up to 5. That caused us a lot of pause here at the department, and we really knew that we were dealing with something that was a lot more virulent than not only we understood, or that the nation understood. Because remember, New York and New Jersey were hit hard and hit fast.
Transition, pandemic to endemic. First of all, just in case we don't know, endemic, the definition of that. And does that mean we're at the end?
I wish I could say we're at the end. Sure. I think, you know, when disease becomes endemic, it gets to a lower level in a certain way that you can live with. We're not quite there yet. Our mortalities are still a little bit higher than we would like. Although, as I said, as of today, we are showing that the northeast part of the state and the southeast part of the state have dropped to very low transmission. The rest of the state is moderate and probably will be going to low transmission. So we will hit a stage of endemicity, something we can live with.
which is very, very encouraging because we're living with it, right? COVID is here. Is it fair to say, like the flu, we know it's out there. COVID, we know it's out there. We can live with it because we have to.
I think the most important thing is not only can we live with it like the flu, I think we'll actually do better. What we have seen with all the mitigation activities in the state, our level of flu last year was absent. We had none. Our level this year is at very low levels. So all of the information and education that has been absorbed by New Jerseyans have really made a difference in their health, generally and specifically for COVID.
Judith Persichilli, Commissioner of the New Jersey Department of Health, thank you for being with us. Learned so much from you, not only today, but over the past 2 years. Thank you.
Thank you. Thank you so much.
You're welcome. For more information and resources about COVID-19, go to our website, cbsnewyork.com.